Hi, it's Dr. Emily Isham, back again for Rare Cancers Australia. I'm here today to address some of the anxiety within our community about accessing necessary cancer treatments during this pandemic. The Australian Government has instituted measures during this pandemic to ensure that people don't run out of medications. And to do this, they've stopped people from stockpiling medications and restricted scripts so that people are only buying them appropriately. They're also allowing people to access up to 1 month's supply of prescribed medication at one time, and they're making sure that pharmacies stay open as they are essential services. They're also putting in the condition that family and friends can pick up prescribed medications on your behalf if you need to be at home. There is now the Home Medicines program, which allows people who are quarantined at home with COVID positive or they're immunocompromised, which is many of our cancer patients, to order medications that are prescribed on the PBS online and have them delivered to their homes. It's good to not stockpile and only get medications appropriately. However, it's good to also remember that should you be put into 2 weeks of quarantine, it might be worthwhile having up to 2 weeks supply of necessary medications just in case. The government doesn't anticipate any medication shortages due to COVID. However, the Therapeutic Goods Administration does publish disruptions to medications on their website, and if there are shortages, they will approve a substitute product so that doctors can continue to treat their patients appropriately with alternatives. If you need to travel interstate for treatment, cancer is Category 1, which is considered urgent for health services right across Australia. Cancer is a high priority condition, which means that despite certain state border closures, you will likely be able to apply for classification as an essential traveller on compassionate grounds, which is for medical treatment. Every cancer we know is different and unique, but your doctor is unlikely to delay any treatment if it's likely to impact on your outcomes. So make sure you talk to the treating team about your options. It's also worthwhile talking to them because some of your appointments that you may have had to travel for interstate may have been moved to telehealth anyway, and you don't want to travel for that purpose. The reimbursement schemes for necessary medical travel remain as they did prior to the pandemic so that cancer patients can access travel as they did before, with consideration to certain state closures. Some clinical trials have been paused during the height of the pandemic, however, many are opening now or will be reopening in the coming weeks. Now, we know that this time has been full of uncertainty and anxiety, especially given we're already in a more vulnerable community in the rare cancers community. So we'd like to encourage you to reach out if you're feeling uncertain at all. Reach out to us at Rare Cancers Australia, your treating doctor, your treating team, or your GP, and I'm sure anyone would be happy to help you. Thank you.
If you found this video from Dr. Emily helpful, you can visit our website at rarecancers.org.au, and there you will find more videos similar to this one, as well as articles and fact sheets inside our COVID hub.